Thanks, Suzanne. Good morning, everyone. So I'll go quickly because I only have 5 minutes, as we've been reminded. And I will look at what is the political economy, all the dynamics, the negotiation and renegotiations of PBF in Sierra Leone over the period between 2010 and 2017 concerning the issue of PBF. I'm going to go quite quickly over the methods, but just so you know, this is a retrospective qualitative case study. And in terms of analytical framework, we used a complementary approach, bringing in elements of political economy analysis and at the same time also drawing from interpretive policy analysis. So this is the framework that we've used. We look at agency, actor and power, agendas, winners and losers out of a PBF policy process. We look at the structure, so the historical legacies, the socio-economic and political context, and the disrupting events that happened over this long timeline. But also we wanted to add this dimension of frames and framing, trying to understand the ideas, the meanings, even the names that were attached to PBF over time. So just to take you very quickly through what happened in Sierra Leone over that period of time. Performance-based financing started to be discussed around 2009, alongside the discussion about the free healthcare initiative. So the discussion at that time was within the technical working group for human resources for health, and it was, in a sense, it was bilateral. Both donors and government were participating to this discussion, which was led by the Department of HRH, Human Resources for Health. But in that discussion, the solution, the option that was taken was to increase salaries and give medicines in kind to the facilities, and PBF was kind of sidelined. So the discussion went kind of in a bilateral way. It moved away to another department, the DPPI, the Department for Policy Planning and Information, and the World Bank, who was the main funder of PBF at that time in Sierra Leone, were having their own discussion bilaterally to negotiate the project. So the preparation, as you can see, was quite short, about a year, and it was heavily led by technical assistance from the World Bank, especially given the weak capacity of the government at that time and the kind of a short time frame that they had. PBF was launched in 2011. It was called the Simple PBF Scheme at primary care level, and it was implemented nationwide immediately without piloting. The implementation went on, as you can see, up until 2016, but there were little changes, no technical reviews to that. And this, again, one of the reasons was that there was no capacity within the ministry to kind of reflect on what was going on. And this was even made worse by the corruption scandal in 2013 that emptied the minister of their few cadres that were available to discuss these issues. Implementation went on, and then in 2014 there was a first external evaluation done by an NGO, Cordaid, which found a lot of challenges, many problems that have not been addressed over time. So Cordaid themselves started a new kind of post-hoc pilot to show that actually PBF could be implemented with less challenges. And this pilot is called PBF Plus and was implemented in one district over 2015. And then in 2016, the PBF Simple, that now was called PBF Light, came to an end because the money was run out and negotiation for the continuation happened, but because of the Ebola epidemic and a lot of other priorities were taking place, these negotiations failed and PBF was stopped. So I'm going to take you in 1 minute through our framework. So looking at actors, we've talked about the Ministry of Health. Clearly, lack of capacity was one of the key features, but also this internal division. The Ministry of Health is rarely a cohesive entity. So the donors kind of use that in what we call venue shopping, trying to go to the department that would be able to answer the questions. Skip the rest. In terms of structure, historical legacies, of course, but also these aided dependencies and what I called the actual frames, the frames that the donor kind of impose for the funding cycles, for the length of a project that define how the project is implemented. And also because they're so strict, they don't really allow the flexibility to deal with disruption like Gavi scandal or the Ebola epidemic. And then these issues of frames that I think is quite interesting. Even in the names, PBF changed name from the Simple PBF to the Light to the Plus. And this kind of tried to show how external agencies were trying to shift the narrative, were trying to to have a broader narrative, not focused only on PBF as incentive for health workers, but PBF as a systemic reform. But this didn't really happen, and as you can see in the last line, there was some sort of dissonance in framing, this contrast, internal and external actor having a different understanding of what PBF is. And this was contributory to the discontinuation of PBF. I'm going to skip conclusions, but you're very welcome to read the paper.